This was, 19 folks. I think almost 18 of them came in by private vehicle, brought in by friends, family, loved ones, and a lot of them were minors. We are not a trauma hospital. We are just a small community hospital, and we did what we could.
Which was saving as many lives as possible. Hospitals across Baltimore were inundated with patients injured in the shooting, and it took a massive amount of cooperation to keep them alive.
We had to rapid triage everyone right away and identify who was unstable, who was critical, who needed our efforts first, and who was someone that could wait a few minutes, before they were seen by a physician. So those 19, all of them did present with gunshot wounds.
Dr. Hania Habib, Associate Chair of the Emergency Department at MedStar Harbor Hospital, says 19 patients came to their ER, all with gunshot wounds, 9 of them minors. Of the 19 victims they saw, 10 were stabilized and transferred.
But as soon as we realized it was more than just that, the hospital went on lockdown, the campus was shut down, and protocols were instituted.
It was all hands on deck for their first mass casualty, something she says they've always trained for just in case.
Unfortunately, we do see a lot of violence, whether it's gunshot wounds or stabbing, so we have experience in managing that type of trauma, but usually it's 1, 2, 3 individuals, but this was 19 people coming in a layered fashion.
Shock Trauma says they haven't been tested like this since 2015 in the aftermath of Freddie Gray's death.
The thing that saves people's lives during mass casualties is organization, and this was as organized a response as I have ever seen.
In all, 15 patients between ages 13 and 17 were treated, while 15 more were 18 to 34 years old. Because of the response, Dr. Scalia says a lot of people lived that otherwise maybe wouldn't have.
You have all heard me say it's not if, it's only when. Well, when arrived on Saturday night, and when will arrive again. And all of us, the entire medical community in the city of Baltimore, will come together whenever that happens.
Dr. Habib tells me in this type of situation, keeping patients, their staff, and patients' families safe is a priority. With so many victims coming in by vehicle, private vehicle, they had no way of knowing if there was an active shooter near the hospital. Now, again, 6 patients remain here in shock trauma, 4 of them in critical condition. Live from Shock Trauma, I'm Janine Donaldson for WBAL TV 11 News.